Hello, everyone, and welcome to our live session. I am Bhavna Nagpal from Careers 360, and in our today's webinar, we will be having some insights on transforming healthcare, emerging trends in the health profession from our panelist, Dr. Arun Maiya, who's a dean of Manipal College of Health Professions, also is a member of National Assessment and Accreditation, a counselor, and Board of Studies and Advisory Member of universities in India and Malaysia. He's a recipient of fellowships from Sparkman Center, from Global Health, and many more. So he has a 35 years of a great experience in allied sciences. So he'll be giving us insights today. So over to you, sir.
Thank you, Bhavana. Thank you very much. Very good morning to all of you. Greetings from Manipal to all the prospective students those who are joining this sessions. First of all, I would like to congratulate each and every one of you for successful completion of your class 2. And also most of you have already written the national level entrance examinations or the NEET and other universities examinations also. In my today's in the next 30 to 45 minutes of interactive session, I just wanted to highlight on the emerging career pathways and also the disruptions in the world of allied health science, or the what do you mean by an allied health science, and why allied health professionals are getting a lot of importance in the healthcare system. Most of you may be looking for the medicines or the dentistry or the allied health science. And especially during this particular time, you have a dilemma which one to select and all. And what will be the future of my career if I select these courses. So in the today's interactive session, I would like to highlight about the importance of the allied health professionals in the healthcare system and how the allied health professionals are gaining importance in the comprehensive healthcare or the delivery to the needy people. If you look at 10 or 15 years back, the health care used to be an individualized, or it is usually called the physician centric. But now it became a patient centric. When we say the patient centric, patient is in the center, and all other professionals involved in the comprehensive assessment and the care will play an important role in providing a quality healthcare to the needy people. Therefore, it becomes a healthcare team, and it is not become now, it's a healthcare team and not an individualized practice or the care. Therefore, allied health professionals are playing an important role in the healthcare system. Before I start the importance of the allied health professional, in the next 2 or 3 slides, I would like to highlight about our university and the institution, because Manipal Academy of Higher Education, deemed to be university, is one of the top ranked university in the country and having very high global reputation. And the founder of our modern Manipal is the Dr. Tonse Madhav Anant Pai, or very popularly known as Dr. TMA Pai, is the architect of the modern Manipal, was a pioneer in starting public-private partnership way back in 1953, and also established many higher education institutions. And then subsequently in 1993, we became the first deemed to be university in the country, established as per the University Grant Commissions Act and also from the Ministry of Education, Government of India. This is the leadership of our university. Our Chancellor, respected Dr. Ramdas Mpai, Pro-Chancellor, then the Chairman, then the Vice-Chancellor, and other leadership team at the university level. Whenever you are selecting any institution, it is important for you to look at the strength or the competency and the caliber of the institution. that play an important role and a significant role in your future career. Therefore, the MAHE always stand tall in terms of the quality of education as well as the quality of healthcare. Thereby, we always consistently maintain the top 10 university in the country, having students from more than 60 countries, 25 professional institutions, having campus both in India and outside India. The most importantly, the Manipal College of Health Profession is the constituent unit of the Manipal Academy of Higher Education, is the one of the largest full-fledged institutions for the allied health professionals in India and Asia. We have more than 70 programs, students from more than 21 countries, and more than 66,500 alumni have been passed out from the institutions and playing a very significant role in the healthcare systems, in the sports industries, and also in the higher education institutions across the globe. So, with this background, I wanted to highlight what is allied health science, why allied health science is important, and also providing the overview of the allied health science courses. Allied health science is a very newly established concept in the healthcare system. It constitutes a separate stream of allied and the healthcare professions contributing to the quality healthcare delivery. There are more than 200 recognized allied health professionals are available in the healthcare system. Therefore, being an allied and healthcare profession, focusing on the preventive strategies, focusing on the early and the acute care and the curative aspect, and most importantly, involved in the long term rehabilitations of the patients with various pathologies. It may be musculoskeletal or the orthopedic related, it may be neurological related, it may be cardiopulmonary related, it may be related to the geriatric issues, it may be related to the community aspect. We play an important and significant role. One of the top 10 fast growing occupations in the global. As according to this top 10 statistics is based on the US database. In the US, the allied health professionals are considered among the top 10 professionals. The 60% of the allied healthcare, the workforce is by the allied health professionals. According to the World Health Organization statistics, by 2030, that 60% of the workforce, which are essential in the healthcare systems, will be controlled and regulated by the allied health professionals. Therefore, there is a huge requirement of the trained and qualified allied and healthcare professionals, even in Indian scenario. If you look at the present statistics, we have more than 140 crores of population. Hardly we have about 10 to 15,000 qualified professionals. Looking at the ratio in which we need the qualified and the competent professionals to provide a good healthcare to our own people. Shortage of allied health professionals in India. According to according to the survey by the Public Health Foundations of India for the National Allied Health Initiatives, there is a significant shortage of professionals in Indian system. The good news is we have an established council that is called the National Commission for Allied and Healthcare Profession, which is established in 2021 by the Government of India. I am pleased to be one of the task force member in that council, and I know the importance of this council and then how exactly this council will bring change and the recognition and the importance of the allied and healthcare professionals in the healthcare system. Maybe here I just wanted to tell two important aspects. According to the commission, we have a National Commission for Allied and Healthcare Profession. Allied health professionals are involved in the diagnostic aspect or in the screening aspect. when we say the healthcare profession, we involved in the an acute care, in the early identification of the problem, and also the long-term rehabilitations of the people. Therefore, it's called Allied and Healthcare Profession Commission. Most importantly, the importance of the allied and healthcare professions was recognized significantly during the COVID pandemic, especially when the patients are in the ventilator. Still, that challenge is still there. People are suffering with the various long-term comorbidities like fatigue, the pain, the multiple joint pain, the so many other complications are still persist in the people following the COVID pandemic. However, during the COVID pandemic, when the people required a very significant the acute care or the emergency care, ventilatory support, our many of our professionals played an important role during the COVID also, like respiratory therapist, physical therapist, cardiovascular technologist, imaging technologist. All these people played an important role during the COVID also. Then the next important thing is the genesis of the programs. Presently, as I said, we are the largest institutions in the country offering almost all the allied health disciplines having more than 70 programs like physiotherapy, speech and hearing, medical laboratory technology, nuclear medicine, occupation therapy, respiratory therapy, clinical psychology, health information management, medical imaging technology, optometry, medical radiation physics, cardiovascular technology, renal replacement, therapy and dialysis technology, perfusion technology, exercise and sports science, anesthesia and operation theater technology, emergency medical technology, clinical nutrition and dietetics, physician assistant, and orthotics and prosthesis programs. This, according to the genesis or the starting of the program, I just mentioned the year with the respective program. So I just wanted to highlight all these programs are as per the University Grant Commission's directives, the programs have been established. Now, all these programs are also comes under the purview of the National Commission for Allied and Healthcare Profession. The minimum duration of the program is 4 years. Most of the programs are 3 plus 1, 3 years of program with 1 year of compulsory rotating internship. However, Bachelor of Physiotherapy, Bachelor of Occupation Therapy, Bachelor of Orthotics and Prosthetics, they are the 4.5 year programs. The 4 years of programs with 6 months of internship. These programs are delivered as per its semester credit based programs, and also we have introduced the outcome based educations in all these programs. So this is the various programs at Manipal. Under the banner of Manipal Academy of Higher Education, we have 4 campuses in Manipal, Mangalore, Bangalore, and Jamshedpur. Allied health programs are offered in all these campus. Manipal, we have maximum number of programs, postgraduate programs, and PhD programs. Mangalore also we have 8 programs where undergraduates and the postgraduate programs and the PhD program. At Bangalore campus, we have only postgraduate programs of 8 disciplines and also PhD programs. In Jamshedpur, we have 6 undergraduates programs. Only we have offering only undergraduate programs and the part-time PhD programs. These are all the various nomenclatures and the campus in which we are offering these programs. Program descriptions, maybe for the understanding, for you to think about which programs is according to your interest, you can decide. So therefore, I give a quick overview about each program very shortly. The first is the physiotherapist are the essential healthcare professionals. They work on prevention, recovery, rehabilitation of various physical elements, especially the pain and the movement dysfunction. However, physiotherapists are now an important member in the healthcare system, starting from antenatal to the geriatric. Normally, we call it from the first breath to the last breath of an individual. The physiotherapist play a significant role in the movement as well as the management of the pain and corrections of the movement dysfunction. Occupation therapists, people across the lifespan participate in things they want and need to do through the therapeutic use of everyday activities. In addition, the assistive technology is very essential in the people with various disability. Occupational therapists provide splints and adaptive devices according to the need of an individual. Common occupation therapy interventions are for the stroke, for the accident victims, cerebral palsy, autism spectrum, learning disability, schizophrenia, depressions, Parkinsonisms, and etc. Respiratory therapists are the specialized healthcare practice in critical care unit, in cardiopulmonary medicine, in order to work therapeutically with people suffering from acute critical conditions, cardiac and the pulmonary disease. Respiratory therapists are also important in the emergency department, newborn unit, as well as in the pulmonary diagnostic laboratory. They also work with all age from premature infant with underdeveloped lungs to the senior citizens with advanced chronic obstructive pulmonary disease. Speech and hearing professions deals with the communications problems as well as the hearing problems. Various pathologies like the stammering or testing and providing hearing devices to the person with reduced hearing help others people to speak and hear. Optometry is a primary healthcare eye care profession aimed at the prevention of blindness and visual impairment. Optometry can all these programs, the physiotherapy, occupational therapy, speech language, optometry can also work independently, have their own clinic. They can work in the rehab center. They can work in the uh, specialized hospital. Independent specialty, primary eye care, diagnostic and non-surgical management, prescribing glasses, and the vision therapy and the rehabilitation. Medical lab technologists work in the diagnostic unit, working in the fascinating career with science and technology with opportunity to help people. On top 10 list of the best job according to the recent survey, both by the Coursera as well as by the other reputed organizations, the laboratory medicine is always in the top 10 job opportunities. Medical imaging technologist works in the patient-centered disciplines using range of technologies to provide diagnostic image and the imaging guidance. Deals with various modalities like CT, like in the imaging, like magnetic resonance imaging, then the ultrasonography, fluoroscopy, mammography, and also computed radiography. Nuclear medicine technologist works in the non-imaging in vitro studies and also works in the various the cancer detections and other pathologies. Cardiovascular technologists work exclusively in the field of cardiac disease, focusing mainly on the cardiology invasive lab and also interventional procedures like coronary and peripheral interventions, device closures, and also for the electrophysiology studies. And also involved in the cardiac diagnostics like ECG, echo, and other procedures. Perfusion technologist works very closely with the cardiothoracic surgeon. Most importantly, they work in the heart-lung mission. Radiotherapy technologist works exclusively in the field of cancer care, involved in the dosing calculations and all other aspects like basically equipment control settings, monitoring of the patient's reactions, and the total amount of the radiation received by each individual. Renal replacement therapy and the technologist works very closely in the nephrology unit, basically focusing on the dialysis of hemodialysis and the peritoneal dialysis, and also managing the people with the end stage kidney disease and acute kidney injuries, those who are requiring the long-term dialysis care. Health information management, if requiring, focusing mainly on the health information aspect in terms of the medical insurance, in terms of the health informatics, in terms of the electronic data records and other related work. Exercise and the sports science focus mainly in the sports populations, focusing on the preventions of the injuries, management of the injuries, and focusing on the strength and conditioning, detailed biomechanical assessment, exercise physiology, sports, and nutrition and the psychology. Psychology is a very important topic or the specialty in the recent past. We have a bachelor programs, we have a master's and the MPhil program. Psychologist works exclusively in all the health and disease population, not just restricting only to the psychiatry, even including the school psychology, school health psychology. All these are gaining lot of importance. Anesthesia and operation theater technologist works exclusively in the operation theater, focusing on the management of the various surgical procedures and the operations theaters as well as the related to the anesthesia procedures. Emergency medicine technology is the works very closely with the emergency department and also in the peripheral unit, like a pre call it normally we call it as the pre paramedical unit or the at the community level, where emergency technologists can work very closely whenever there is an emergency or the disasters develops. Clinical nutrition and the applied dietetics, they work very closely in the various clinical department of the hospital, focusing on an individualized, customized clinical nutrition. Examples like in the lifestyle disease or in the acute care or in the people in the palliative care. Bachelor of Physician Assistant is the new program, but one of the very important programs having an excellent opportunities in India and abroad. However, all these programs, the program I listed from the first programs to the till now, all these programs are having an excellent opportunity both at in India in abroad. Physician assistants are very the professionals involved in the medical history taking, physical examination, related investigations, and also preparing the patients for various surgical and the other procedures. The last program is the Bachelor of Orthotics and the Prosthetics. They involved in the assistive technologies, developing a newer technology which are essential for the correcting the deformity, improving the mobility, and improving the postures and all. They can work very in the variety of settings like rehabilitations unit, hospital, and other, even in the multinational companies. So why Mahe? The most importantly, our students are getting a lot of exposures in the reputed universities across the globe. The students' mobility, the students' exchange program is one of the important the initiatives and the strength at our university. Many students from various other universities from across the globe visit our institutions. At the same time, our students also get an opportunity to go and visit other universities across the globe. In addition to the quality training at the institutional level or at the hospital level, we also give equal importance to the community engagement. Therefore, all our students are getting excellent opportunities in the healthcare camp and organized by the hospital. This is one of the important aspect for them to get a good skill, both at the institutional based at the outreach program or at the community level. This is the program durations and the entry criteria, which will be available in our admissions office also. Some of the departments are having the different admission criteria, but science is the must with having the +2 in PCM or PCB is the criteria for the various programs. Career advancement. So most importantly, after you successful completion of the program, what next? That makes the programs more interesting, more demanding, and also it's an important need for the prospective candidates and the parents. All our programs have an 100% placement, both at the graduate and the postgraduate level. They can work in the hospital, they can work in the rehabilitation center, they can work in the academic institution, they can go for the higher studies, both for the post graduations and the PhD. Most importantly, during the training, we have a group hospital, Manipal Hospital. Our students are getting an extensive opportunity and the clinical exposure at our group hospital also. Admission process is purely on the merit. We have a national level entrance examination for the all these courses, which will be conducted by the admission department of our university. We have an admissions under the general category as well as the foreign or the NRI categories. Admission process, you can apply through the online. This is the once you go and click on the link, you get the detailed informations about the course, the admission criteria, the eligibility criteria, and everything will be all the details are provided in the admission process. Most importantly, my purpose is why you need to select Mahe as your destination. The first important thing is our course is recognized by the Healthcare Profession Council of UK. It's easy for our students after successful completions of the either the graduations or post graduation, they can immediately register under the Healthcare Profession Council of UK. We got an excellent recognition award by the Rehabilitation Council of India as well as by the ministry. All the programs are recognized by their respective councils and the professional body. All the programs are having the outcome-based education, credit-based semester programs with advanced pedagogy and the research. We have a program and the course electives or the open electives. Most importantly, the strength of our program is, as I mentioned in the beginning, we are the skill-based professionals. Therefore, your competency, your clinical skill is very, very essential. Therefore, during the training, we have been attached with the more than 2,150 bedded tertiary care hospital and the outreach program. Therefore, you have an excellent clinical training and your clinical skill and the clinical competency will be much, much higher as compared to the any other institutions those who are offering these allied health programs in the country. Therefore, the any industry, healthcare industry, any university, they prefer the Mahe graduate to be absorbed either for the higher study or for the job because of their competency. State-of-art preclinical laboratory for the quality preclinical training. We have an excellent student support systems of called teacher guardian. We always maintain the good faculty to students ratio, a maximum of 10 students for one faculty. That is the criteria in which we define our students intake as well as the faculty appointment. Reputed alumni working both at the national and the international universities. This is you can for informations, you can contact these numbers both at the university as well as at the our institution's office also. Both the landline number, email IDs have been displayed in this slide. So thank you all. In case if you have any questions, any clarifications related to the academic process, I'll be very happy to answer to those queries.
So I
Over to
have
Bhavana. Over to Bhavana. Any
Thank you so much, sir. That was very, very informative for all of the students, and I'm sure that everyone must have got a great idea about the all of the courses which are there in Manipal. So, sir, I have posted some questions in the chat box. I request you to please address all of them. So, there
Okay.
are from the students. They're asking some questions.
The biotech fee structure, I think they need to talk to the admission office. Biotechnology comes under the School of Life Science. Other than that, any other questions? I am not able to see other questions.
Yeah, yeah, yeah. So,
Yeah, admission is, as I mentioned, it is on the one question is on what are the admission requirement for the program. Is there a specific entrance exams or criteria I need to meet? As admission process is purely based on the merit. We have a national level entrance examination for all our allied health courses. Then based on the entrance test score as well as the plus two percentage, the director admission will prepare the rank list. And then subsequently, through the counseling process, the students can opt for the course of preference. Okay, the next question. Am I clear with this question?
yes, sir. Yes, sir. You can
Okay,
proceed
okay.
further. Yeah.
Yeah. The next question is any online allied health care courses that are US recognized university. How do I enroll them? As such, in allied health sciences, online courses are not encouraged much because, as I mentioned, it is a skill based program. Hands on trainings are very, very essential. However, the students can join for the value added courses during the when they join program, which will have some weightage like in related to the research in allied health science or some of the courses they can opt, but that is going to be a value added. But your clinical competency is very, very important for all these programs. Therefore, it is a full-time program which have both academics, which have practical and the clinical uh, training are an integral part of the course. Which course have more demand, biomedical or biomedic technology? I think admission office, if can able to answer this course. Internship would be provided by the university. What about placement? Will the university facilitate that? Yes. Internship will be provided by our teaching hospital, and also we are providing the internship in associations with our group hospital. Our Manipal group or the Manipal hospitals, more than 27 hospitals are in the country, and we have a strong association with these hospitals. So as per the need of that particular programs, we are coordinating with the hospital and then provide the internship. And also, we more than 2025 healthcare industries and the institutions, they are coming to our institution for the placement. And we have a very robust placement cell at our institution. And also, we work very closely with the university placement cell. So, the placement is also provided at the institution. Which course is better? How to choose? Because at this point, I'm not very clear about what to take. If you share your email, I think our team we will have an one-to-one interaction because all courses are important. All courses are having the equal demand. We always suggest the student that what is your interest? You wanted to be in a diagnostic field, you wanted to be in a rehabilitation field, according to or you wanted to in a practice field, according to that, we usually we'll have an one-to-one interactions with the student, and then based on their interest, we suggest them. But however, we give the freedom for the students to select the course which they are interested. Will not say that this course is better, this course is not good. No, all courses are having the equal demand, equal importance, but the course selection is based on the student's interest. That you can have an one-to-one interactions with us, then we will be able to provide the detailed in mentorship or the advice. Please elaborate on scholarship provided at the Mahe Allied Health courses. We have various scholarship programs, including the School of our Academy of General Education and other scholarship programs. I think Mahesh and team, I think Mahesh is there. I think we'll be able to add this on the scholarship programs. Anyone from the admission office? We have a scholarship. If no, then I will tell that at Manipal and Mangalore, we have a merit scholarship based on your entrance test as well as your overall ranking. And also, if you are a part of the our Academy of General Education student, then you have a scholarship while admitting to the program. Subsequently, if you are joined selected like programs like physiotherapy, we have a scholarship programs from the it's called the Bandarskar's scholarship program, one of the scholarship I am just mentioning. Then we also have other specific scholarship based on the performance and the merit during the that particular course. For the Manipal Tata Medical College program or the courses, Maya is giving the minimum of 25 to 30% of scholarship to the Northeast students, those who are joining the MTMC program. Then we also have a Northeast scholarship programs. The student, those who are coming from the Northeast region, will also get the minimum of 25% of support in the tuition fee. Okay, then next, what is the scope for the dialysis program? Dialysis, as I said, in the dialysis centers, the increase in the uh, prevalence of the renal or the kidney disease are increasing rapidly in the country and the globally. The dialysis program will have a huge demand. What options do we have after doing a Bachelor of Occupational Therapy? And after successful completions of the UG program, either you can work in the hospital, you can start your own clinic, you can join for the postgraduate program in the reputed institutions. Our own institutions are offering the PG programs in the occupation therapy also. Which is better in allied health courses, cardiovascular, respiratory, or perfusion? All courses are having an equal importance. Cardiovascular is more into the diagnostic aspect. Respiratory therapy is having both in the involved in the diagnosis and the acute care of the patient. Perfusion technology is work very closely with the cardiothoracic surgeons in the operations theater, mainly focusing on the heart-lung missions and the managing the patients during the surgical procedures. Please share some insight on career prospects for the medical laboratory technology. As I mentioned, the laboratory tech science is gaining a lot of importance now. After successful completions of the BSc in medical laboratory technology, they can work in the reputed labs. The diagnostic labs are now uh, gaining a lot of importance. The second important thing is the home health program, like the diagnostic procedures at the door level to the patients have also been started by many industries. So you can work in those industries. There is an opportunity for you to work in the hospitals and then the diagnostic center. There is an opportunity for you to do the specializations in the laboratory medicines in the biochemistry, microbiology, transfusion medicine, pathology, and other areas. Then you can also go for the PhD programs. And there is a lot of opportunities in the globally, especially in the Gulf countries for the uh, with people with the medical lab. Next is, do I have a chance to go abroad with an allied health course? Yes, you have a significant opportunity to go. And presently, 80% of our alumni are in abroad. Only hardly 20% are staying in India. That shows the importance of and the demand of the allied health professionals across the globe. Difference between BSc respiratory therapy and BSc cardiac perfusion technology. Respiratory therapists are working exclusively in the critical care unit, involved in the intubation, involved in the ventilatory care, involved in the diagnosis like a sleep study, and also performing the arterial blood gas analysis, and then the uh, pulmonary function test like that. Whereas cardiac perfusion technologist, it is not cardiac perfusion technologist. We have a cardiovascular technology separate course where cardiovascular technologists are works exclusively in the areas like the cardiac departments, diagnostic procedures like ECG, echo, treadmill test, and also involved in the cardiac procedures like interventional cardiac procedure, involved in the neonatal ICUs and all. Whereas the perfusion technologist works exclusively in the area of the cardiothoracic surgery. BDS application forms were not available, is that Nature could not see them on the that I think you need to directly write to the director admission. He will be able to provide you the correct answer. Can you please tell what does healthcare management entail? Healthcare management is involved in the like the medical insurance is playing a very important role in the comprehensive healthcare. Healthcare management professionals are involved in the medical insurance things, involved in the electronic medical record system, involved in the development of the various database which are essentials for the uh, healthcare systems as well as for the industry like insurance industries. The people are also involved in the health informatics. Now the artificial intelligence gaining a very important role in the healthcare systems, whereas medical informatics, medical health informatics play an important role in these aspects. In addition, they can also work as the health administrator, healthcare manager, operational managers in the hospital. BSc Medical Technology means working in a lab more in technology or more in the medical field. In both, you work as a laboratory technologist in the healthcare industry, in the medical uh, or the hospital, mainly for diagnostic purpose. If I have not opted for bio in 12th, but now wants to go for medical field, you can join for the courses like if you have a non-science background, now you can apply for the health informatics programs, partly for the sports science program. Health informatics, health information management program, we take even without the science background. Are there any branches in the North India of yes? We have 6 branches in our Manipal Tata Medical College. We have the Bachelor of Cardiovascular Technology. We have laboratory technology. We have optometry program. We have renal replacement and dialysis technology programs. We have health information programs. These all the 6 programs are offered at our Manipal Tata Medical College campus. We have a separate department of allied health professions under the Manipal Tata Medical College. Form D will be a separate things. Form D is comes under the Manipal College of Pharmaceutical Science. If you drop an individual mail, we will be able to help you. However, Pharma D is having the, it's a doctoral program, having a lot of opportunity in the industry as well as in the healthcare setting. You can independently work as a clinical pharmacist in the healthcare systems, or you have an important role in the uh, pharma industry for various research and other industry academia partnership. Bachelor of Science in Radiotherapy Technology is a separate thing. Radiology comes under the medical imaging technology. It's a good question. Radiology comes under the, it's called radiology under the medical field. We have a branch called the medical imaging technology, where all the diagnostic procedures like X-ray, ultrasound, CT, MRI, the computer radiology, radiodiagnostic procedure, all this comes under the medical imaging technology. Whereas Bachelor of Radiotherapy Technology comes exclusively works under the cancer unit. They are involved in the dose calculation. They are involved in the tumor marking. They are also involved in the various diagnostic procedures which are essential for the diagnosis of the cancer patient. Subsequently, they can also work under the uh, Board of Research in Nuclear Science or Board of Atomic and Regulatory Board. In these areas, they can work as a medical physicist. Whereas imaging technologist works as the imaging technologist or the radiation safety officer in the healthcare system. Radiotherapy technologist works as the medical physicist or even the radiation safety officers in the healthcare system. The last slide, if you have gone through my last slide, Manipal institutions are known for quality education. The last slide, if you see, as I said, one is all programs are recognized by the regulatory body, not only in the country, also recognized by the global accreditation body. Second important thing is our curriculums are very dynamic, advanced, on par with the international reputed universities, so that the credit transfer, the clinical exposure during the course is possible. The third important thing is we maintain a very healthy and a good faculty students ratio, so that one to one faculty students interactions is very, very good as compared to other institutions. The fourth important thing is this is the only healthcare profession institutions or the allied health institutions in the country is attached with more than 2,300 bedded tertiary care hospital, and also having a very strong outreach program. As I mentioned, the clinical competency, the clinical skills are very, very essential for the allied health professionals that we are providing as compared to other institutions. Thereby, all our students are having a very smooth transitions to the abroad if they want to go and work outside the country, or even want to go for higher studies in the various global reputed institutions. The next is Bachelor of Science in Neuro is related to the neurology. So neurotechnology, electrophysiology, it's in the pipeline. We also wanted to introduce. Yeah, exclusively they work in the field of neurology in the various diagnostic procedures for the neurological conditions like electroencephalography, sleep study, then EEG, as I said, then also the various neuroimaging. All these things they are involved in performing these tests or the procedures in the neurological condition. Says it has not grown yet. As I mentioned, it is an upcoming field. always upcoming field is having better opportunity as compared to the disciplines which are already established and reaching to the a saturation level. Therefore, there are plenty of opportunities. Plenty of opportunity. If you look at in technology, engineering side, people are prone for the computer because there is the job opportunity, the demand is very high. The similar way in the allied health profession is an upcoming and the emerging field in the healthcare system. Therefore, the job opportunities are very high. What about BMS courses? Did not see anything about the BMS. We are not offering in our thing. Ayurvedic medicine and surgery is a separate programs, which the MAHE is as of now it's not offering. If I pursue perfusions or cardiovascular, what do you think will be the monthly salary for an average? I'm talking bachelor people. Average it in a, if they get a job in a very good hospital, salary will be minimum starting with, you can say about 4.5 lakh per annum for a bachelor, almost 7 to 9 lakhs for the master student. This is the minimum salary. Okay. Yeah. Bhavana, if there are any more questions, otherwise.
Yes, sir. So students are asking that BSc in critical care technology has a wider scope or not.
Is it, I'm not able to see that question.
Um, so I think
Anesthesia and operation theater technology. They it is a very upcoming field. Now, even in the medical specialties, specialized super specialty programs have come. Examples like neurosurgery, cardiovascular surgery, cardiac surgery, so many. So each surgical unit requires specialized operation theaters and the anesthesia unit. Therefore, critical care or the anesthesia and operation theater technologist will have a high demand also. Depends upon as the medical specialty is also expanding.
so, sir, that would be great if you can provide students some insights on the admission process because they are having little confusion about it. So, if you can provide some more insight on it.
Regarding admission,
Yeah.
can I just repeat the
Yeah, so I was saying the students are really curious to know about the admission process. They are having some queries about it, that how to get into Manipal and what will be the process. Do they have to go for the NEET exam
yeah,
or not, or will that be valid? So can you just
yeah,
provide more information on
okay.
it? Yeah.
At presently, for the all our allied health programs, for Manipal admission, Manipal means Manipal campus admission, Mahe campus admissions of Manipal, Mangalore, or Jamshedpur, student no need to go through the NEET. We have our own entrance test called Manipal entrance test that for this academic year we have already completed. However, after the examinations also, entrance examination, we have kept the application process open. Students can apply directly to the admission office. Once our rank gets exhaust, and if the students are having the good percentage in the plus two, based on the further screening, admission office will also consider them for the current year. Next year onwards, usually our entrance examination is conducted in the month of April. So the students can apply early and then the write exams and then get admissions to the various programs. However, as of now, they no need to go through the NEET for the Mahe campus admission process.
Okay, sir. So there is one more question from another student who's asking for BSc of Audiology and Speech Language Pathology is related to pathology department or not.
No, it is not. Pathology is the abnormal condition. When we say the pathology, it's an abnormal condition. The patients with the ENT, for example, if they have a hearing deficit, it's called the hearing pathology. If they have a communication deficit, usually you call communication disorders or the pathology. Examples like larynx care. Patients will have a larynx cancer. Usually the larynx will be removed. Then we have to communicate them through the various tracheostomy procedures or with the artificial implementations of the larynx. Therefore, based on this condition, it is called speech language pathology. Means we are studying the abnormal conditions which are related to the speech and hearing, not the pathology department.
Also, so students are asking about the interview processes. They, if you have any interview process post the examination, for the Mahi admission.
So after the entrance examination, as per the university guidelines, the rank list will be released. Then subsequently, the admission office will communicate to them to like through it's a online counseling. In that, they will be asked to select their preference. So there are no specific interview for the undergraduates program. However, for the postgraduate program, we have a different programs like Master of Physiotherapy, Master of Speech Language Pathology, Clinical Psychology. We have a MAHE entrance test, subsequently counseling. But all other postgraduate program, we have an institutional level and test followed by the interview by the department, and then we select. But for the undergraduate students, it is based on the entrance ranking, then the counseling process, and there is no interview.
Also, sir, do you have any government seats in Mahe for MBBS?
MBBS as of now, I think in Mangalore campus it is there.
Okay.
But however, they can write to the admission office and clarify these doubts. Because every year the guidelines, the government norms are changing. Therefore, but for the Mangalore, there are some state through the like as per the state norms, some even for the Jamshedpur also, that they can write to the admission office and then get the clarity on that number of seats and other things.
Okay. Also, so students are very curious to know about the placements as they are going to spend so many years for their education, and they definitely would want to know whether they will get a good placement or not, because that is the one of the major things which students are very much concerned.
As I mentioned in the beginning, it's an emerging branch in the healthcare system. Placement is not a concern. All in the last 10 years, I'm just giving you the example. Last 10 years statistics, no single students of our institutions is staying at home without job. Depends upon their competency, depends upon their skill. The remunerations vary, but or the package will vary, but all of them are getting the 100% placement either in India or abroad.
So I have one more
Job is
question.
not a concern. Yeah.
So sorry about that. So there is one more question. Which do you think is the better research, like biotech or allied healthcare program? Which would be the better
Now
one?
all research are now interdisciplinary research. Therefore, either if you do in biotech or allied health, the focus is on the public health concern, means our research is on the public health. Both research are good and it's all interdisciplinary.
And can you please give us some more details about the fee structure?
Fees is varying from course to course. what they can do is they can just log on to the www.manipal.edu, and when they go to the allied health section, they get the very clear descriptions about each course. What is, for example, if they are joining Bachelor of Physiotherapy, what is the fee structure? If they are joining Bachelor of Medical Laboratory Technology, what is the fee structure? If they are joining Bachelor of Sports Science, what is the fee structure? It is mentioned there because there is the difference in each uh, fee structure in each courses also. I request them to go through the www.manipal.edu admission, then go through the allied health, then click for the fee structure. It is readily available for all the programs. Okay.
Yeah, so we do have two, three more questions for you, sir.
Yeah.
I hope you can see it in the chat box.
I think I till perfusion and or cardiovascular I responded to that. Any more new questions? Okay. Medical allied health courses, which course is best? Some syllabus related to. See, allied health courses, the foundation is in the first 2 years, they need to go through the pre and paraclinical subjects like anatomy, physiology, biochemistry, microbiology, pathology, community medicine. All these courses, they need to go through that. The course structure may slightly vary from according to the curriculum. Then they also have a course specific subjects. BSc in critical care technology has a wider scope. Yes. As I said, anesthesia and operation theatre technology have a significant demand as the medical specialties, the super specializations, and the operation theatre is expanding. Therefore, there is a wider scope. Audiology, I think I have already asked. What is the job role of physician assistant? Is it recognized? What is the curriculum and can I go abroad with this? Physician assistant is a new programs in India. Only few institutions in the India are offering this program. It is recognized by the even by the National Commission for Allied and Healthcare Profession. The new council have recognized this course. The next point is US, there is a significant demand for the physician assistant. As to my knowledge, no hospital in US is runs without physician assistant. Physician assistant is very, very important in the healthcare system. Since in India it is an upcoming field, maybe awareness is slightly less, but in the next 5 to 10 years, even in India, I am very confident that every hospital needs physician assistant in every department, so that they have a very significant importance opportunities in the healthcare system. Physician assistant program is having, once again, the fundamentals is same pre and paraclinical courses. Then they have a physician associate practice in different unit like medicine, ENT, pediatrics, OBG, oncology, surgical unit, orthopedics. Like that, they have the student will under course specific, like orthopedic specific, medicine specific. These physician assistant trainings have been defined in every semester. I have already explained about the entrance exams and process. Explain what are the physician assistant course I have already told. Is there any this also I've already mentioned. Placement state I've already 100% placement. This also allied health and biotechnology course. Fee structure I've already told. Any student who has interest in dermatology, what will be the best course? Dermatology related, they can take either physician as well, wound care, all those things play an important role there. Physician assistant or physiotherapy they can take. In all allied health, we have a Mahe entrance test. As of now, for our university, we are not comes under the purview of thing. Physician assistant, once again, I have explained. Financial aid, I have explained about the various scholarship scheme. Yes, you can opt. If we opt for an allied health course, we'll have to no need to go for NEET PG or anything, especially for the admissions to the allied health programs under MAHE, you no need to go through the NEET.
All right. Thank you so much, sir.
Thank
That
you.
was very, very insightful. And I hope that this is going to be fruitful for all of the students. And
Yeah.
for any more assistant, they will definitely be reaching out to you on your website and on our booth today. So all the
Yeah, we
students,
have
I
mentioned the
request,
email IDs also. I
yeah,
think you, yeah.
yeah, we all can see it. So for I request all of the students to, if you have any more queries, any more questions, please feel free to visit our booth, and our counselor is going to help you out over there. And for any more queries, of course, you can definitely visit on the website of the Manipal University. So thank you so much, sir, for being here, and it's an honor. We had a pleasure having you, and we hope that we are going to meet again for more such insightful information. And thank you so much, sir.
Thank you, Bhavana, and yeah, thank you, Bhavana, and the entire team for organizing a very excellent interactive sessions with the prospective students. Thank you very much, and I wish each and every students all the best in their future career, and looking forward to see some of them at our Mahe educational institutions also.
Yes, sir,
Thank you all.
definitely.
Thank you.
Thank you so
Thank you.
much.
Yeah.
Thank you. Thank
Thank
you.
you. All the best. And thank you. Bye.